Which of the following statement relating to the omphalocele is false? So omphalocele, we know the omphalocele is one of the disease procedure in which the gastrointestinal tract of the baby lies outside the normal position and it present outside the abdominal wall. And we have to know details about the omphalocele and which statement is not true. We have to find out. Here the options are the herniated organ lies outside the peritoneal sac, cardiac abnormalities coexist in 25% of the cases, cecum is usually right-sided, defect occurs through the umbilicus, mortality may be as high as 15%. So let's see the omphalocele. Here we can see the omphalocele in two pictures. In the first picture here we can see is the omphalocele, and in case of this omphalocele, what occurs, the intestine is present within a closed sac. Here we can see this is a sac outside. In the second picture also, here we can see the outside there is a definitive sac present, and the gastrointestinal tract or small bowel, they usually present within this sac, and it is known as the omphalocele, and it occurs through the umbilicus. Here we can see this is the position of the umbilicus and it occurs through this umbilicus. So the gastrointestinal tract, especially small bowel, comes out of the abdominal wall outside the abdominal cavity, and it is covered by a sac, and it is the omphalocele. Here the another picture, and here we can showing this the bowel, and this bowel, it is covered by the peritoneum. And this is the another picture, and here we can see the small intestine there comes out, but there is no coverings. The small intestine which comes out of the normal position, which is the abdominal cavity, out to the outside of the abdominal cavity, and here we can see there is no sac or covering. So in this condition it is the gastroschisis. So there are two important different things. One is the gastroschisis, another is the omphalocele. In case of the omphalocele, it is outer covering present, but in case of the gastroschisis, outer covering absent. So which is false regarding the omphalocele? Here we can see this is the herniated organ outside the peritoneal sac. It is not true, because we know in case of the omphalocele, the peritoneal sac present, and the herniated organ it present within the peritoneal sac. Other options here, such as the cardiac abnormality may coexist with 25%. It is also true, because in case of the omphalocele, other important, here we can see the malformation, such as here the cleft lip present, so other abnormality present. And the cecum is usually right-sided. It is true, because cecum usually located in the right-sided, and in case of the omphalocele, it present in the right-sided. Defect occurs through the umbilicus. It is also true, and the mortality may be as high as 15%. It is true, because when the intestine it is outside the abdominal cavity, it loses water, electrolyte, and patient usually goes dehydration, and finally kidney shutdown and death. So the mortality is very high. So in case of the omphalocele, only false option, that it is outside the peritoneal sac. It is not true, because omphalocele it present inside the peritoneal cavity, but in case of the gastroschisis, the bowel present outside the peritoneal sac.